All right, Steve, I think we're good to go.
Okay. Good afternoon, everybody. This is the Friday, April 30th, 2021 Board of Health meeting. I'd like to remind everybody that this meeting is being recorded by video and audio. Pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. Click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in the order they were raised. If you do not have an audio capable device, the Q&A button can be used to take a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. Questions should be directed through the chair. For attendance purposes, for the board, as I see you, can you just acknowledge that you are here? Anybody else that comes on, please announce your name before speaking to keep good records. James Cooper.
Here.
Melissa Murphy.
Here. Here.
And Roberto.
Here.
Okay, so I guess we'll, any public comment that you see before we get started?
Anybody wants to have any public comment or anything that's not on the agenda, use the raise hand button if you can. If not, it looks like we're good.
Okay, update on the Board of Health emergency order number 13, masks.
Okay, so in light of the most recent orders from the governor that removed the outdoor mask mandate across the state today, this morning, and then the CDC recommendations have now been lifted. There are further restrictions for outdoors only. We're here to discuss this emergency order number 13, which requires masks across the whole island, indoors and outdoors. My recommendation would be that we do remove the outdoors section. We can remove all the outdoor parts in emergency order number 13 and get that posted later this weekend. And then from there, what we'll end up doing is mainly because we have seen some transmission of COVID-19 in the outdoor areas, but only when people are in close proximity to each other for extended periods of time. Typically, where outdoors, there is a wind, there's breeze, there's all sorts of desiccants that will prevent the virus from spreading. So we have only seen minimal transmission outside. I do feel comfortable removing the outdoor mask order, but I'll let you discuss.
I think that we should keep it on for at least town and Sconset like we started with, because I do think that people will be walking around town and not wearing masks, and then we're asking the restaurants and the business owners to be responsible for policing that, which I don't really think is fair. So I do think that in town and in Sconset, we should keep the mask order for outside. I also wonder for like large weddings, because they've increased over the summer, it'll be increased significantly the number of people, and people will say, oh, well, it's an outside tent. And so they can not wear masks. And I really just don't want to see things blow up the way that they have in the past. And we're still having cases. So I just have some reservations about lifting it completely. Boston is not following the states. And I don't know that we should follow the state right away, especially as we're heading into the busy season.
Is there anybody else? Any other board members first before we go to the hand? Melissa?
Thanks, Steve. I had the same thoughts, Mary, about leaving the mask restriction outside in the
sales pipelines, construction.
historic districts of town and Sconset. To me, particularly in July and August, those operate somewhat like outdoor venues, stadium kind of things. You've got passersby and outdoor dining, so there's a lot of close contact. It's hard to be physically distant on the streets of town. But Roberto, I'm just curious what your thoughts are on that, because I'm sure you considered that before giving us your recommendation.
Absolutely. So the biggest issue that we're running into when it comes to enforcing any of this outside, and it's the same issue we ran into last year, was as awful as it sounds, we simply don't have the person power. We cannot be at all places at all times, even if it is just the core district. So one of the things that we're running into is we already have an overworked staff, and having us out there at 24 hours a day with an onslaught of phone calls is just not feasible. We have to be able to look at the full risk assessment. What can we take care of? What can we enforce, and what can't we enforce? And this is something that when we do when we remove the masks from outside, that is something that makes our ability to enforce the other aspects of the mask order better, especially when we know that the primary form of transmission is through indoor transmission.
Melissa?
Thanks, Steve. Just to follow up on that, thank you, Roberto. Could you remind the board, I feel like I got a little confused on what these new orders say from the governor in terms of, I think Mary also referenced outside events being held outside. Will those be under a different set of rules? Could you just maybe review what these new rules are for us?
So yes, there are specific guidances for events. For example, whenever you do events outside, yes, events with the side flaps lifted up and the side flaps that aren't closed are considered to be outside, regardless of the size of the tent. We do still have the size limit, where outside it is starting on May 10th. It will be 250 people outside, 200 inside. But many aspects of businesses across the state still have guidance, specific guidances. So performance venues have their own guidance, restaurants still have their own guidance, movie theaters and other performance venues. They all still have sector specific guidelines that they have to follow as part of this. This affects mostly just the areas when you're out on the sidewalk, when you're on parks, when you're on beaches, things like that. But we do expect that when people when they get into line, when they go into their restaurants, just like they're already enforcing, people should be wearing masks when they go indoors, retail establishments as well.
Go ahead, Jim.
My question is, no masks, mask, where would the line be, for instance, in Sconset? Do you want a mask just in where the center of Sconset is, or are you talking about all of Sconset? And when you get to town, where is the mask, no mask line going to be? Is it just the core district, or what are we actually talking about?
What I'm suggesting is that we remove the outdoor mask order across the island. so that people are only wearing the masks indoors. But if you want to set it in to be outdoor masks as well for any of the core districts, that's up to you. But I'm suggesting that we go island-wide.
Okay, fine, thank you.
Melissa?
Are there ongoing concerns, Roberto, about our status? I know you mentioned to me earlier that the state's not always using this color-coded red, yellow, green status anymore, but it is somewhat concerning that we have, I think it's still a maybe 6% positivity rate today. I can't remember what I read, which is certainly trending downward, and that's good. But to Mary's point, I think we're at this interesting juncture of, finally getting some good vaccine supply and getting more residents vaccinated. I think across the country, more people are going to be able to get vaccinated, but we're still seeing this high positivity rate. My instinct says that removing the outside mask mandate's not going to have a tremendous impact, but I do have concerns around job sites and these larger events that are coming online in the next couple of weeks while we still have this much virus in the community. So that's where my confliction is right now.
Absolutely. And for as long as we have 2 cases, 3 cases a day, anything like that, we are going to see ourselves in the red. Because if we do 2 or 3 cases a day, that strikes more than the 14 cases that are going to put us in the red district. And the faster our population grows, the more likely we're going to be in the red. That metric has never actually been good for us because the state is using the census numbers as our for our calculations, when just our sewer numbers from this Saturday or from this past Monday was at 1.46 million gallons, which puts our population at around 22,000 people, which is double the denominator that the state is using. So even if we're showing a positivity rate of about 6.57% among those who are being tested, that is closer to actually 3 or 2% based on the amount of just the sheer numbers of people that we have here already. So and one of the things that's really important to start paying attention to when it comes to this COVID situation is it's evolving faster and mutating faster than anyone can have expected. So it mutates just as fast as the flu, which what I'm trying to say is COVID's here to stay. So we're going to be seeing 2 or 3 cases a day for the foreseeable future, for a couple years. And we're going to have to learn to live with the acceptable risk that is COVID. And when we start talking about cold and flu season, it'll now probably be more like COVID and flu season. And we'll probably be looking at seasonal booster shots, just like we do with the flu shots. The difference is, just like with flu, over the course of the last year and a half now, we have, as a society, learned how to treat this virus. So death rates are really low and long-term effects low. So this is starting to become a virus or an illness that we are going to see spread and be endemic to the United States and the rest of the world for the foreseeable future. The more we post how many cases we have, unless those cases are jumping up to 10, 20, 30 a day, we're not looking to be overwhelming any sort of our hospital system anytime soon.
Meredith?
We haven't seen if we're going to have a jump after April break yet, because this is our first week back at school. So I would say in the next week is when we would see if we're going to have a jump from that. And I just am concerned that we're putting the business owners in a place where they have to police this again and can't let people in their store if they're not wearing a mask, when we could just say the historic district, you have to wear a mask, and the area of Sconset, the downtown of Sconset, you have to wear a mask, and that's just the way it is. If you're out in the moors running around, you don't have to wear a mask because you can socially distance. But I agree with Melissa. If you're walking down Main Street in July and August, you cannot socially distance. And I just think that we're going to cause more problems. I really feel like we need to be a little more proactive in keeping the mask order for the core districts to protect ourselves.
I'll make my little comment, which I just read about a stat, or actually listened to on the news today. Cape and the Islands, 59% of the Cape and Islands is had at least one shot. 49% of the Cape and Islands is vaccinated. By May, they think that number is going to be up as high as 75%. We've got people coming from all over the country, all over the world here, mask, no mask. To police two different areas of the town it's impossible. So, I mean, everybody's used to a mask. They know when they go inside, before you get seated, whether you go into a grocery store, you got to wear a mask, confined space. Outdoors, it's to police certain districts, I think it's just not going to happen. You're going to create havoc with people yelling at people. So I mean, I'm more in line with what the state's doing and what Roberto said. You want to take one of these hands?
Sure, absolutely.
I think Pamela Sewin was up first.
Thank you. Just for point of reference, I live on the island 6 to 8 months a year right now. For the past 20 years, before I lived there more, I do still own a home in the historic district of Sconset. I also have a master's degree in public health, and I'm doing some work down in the Baltimore area when I'm not there. So I get a lot of data out of Hopkins. Having lived through this last summer, both in the historic district and going into town, I will say that there were areas of grave concern. The lines that form outside establishments, and I'm just going to name these publicly, like the Lemon Press, where the staff there did not enforce social distancing because they were too busy texting on their phones and being 20-somethings. I'm worried about what happens at Cisco Brewers. They did reservations for a while. I know they've reconfigured the space, but lines will form places. And to me, the thing that's going to keep Nantucket in the best shape this summer season is to make visitors and residents feel safe. And I think Mary and Melissa have good points. We are all used to masking. There is, I saw very little like harassment and yelling at people in the historic district or downtown last year. In Sconset, we actually had people volunteer and hand out masks to people because it did get very crowded around the market and different areas there and tour groups. And I just think as a society, we're used to masking. The island is a very fragile place. And I think that just because a governor changes a regulation, it might not be in the best interest of the island. I think staying a little more vigilant might help. And also, Roberto, one question I have for you is, can anything be done to keep the landscapers and other groups aware of the fact that they still shouldn't be in a truck together unmasked, even though that truck may be outdoors? Because I know that, I personally handed out a lot of masks to people working last year who were wearing gaiters and tried to explain to them, why they needed better protection. So I'm just chiming in as someone who thinks it's not really harassing to ask people to keep their masks on. It would just be kind of prudent right now until we see how the spring and the summer start to unfold. Thanks.
As landscaping and construction crews as part of the masks, we have sent countless amounts of information to them through emails, through enforcement orders, and things like that. They are aware. We do have to catch them actually doing it before we can give them a ticket. And that's been the hardest part. It's the same issue we're running into with enforcement of masks outdoors. It's just really difficult. And in many of the cases, when the tickets got challenged in court, they got overturned.
And we'll go to Mary Watson.
Yes, good afternoon. Thank you for hosting this meeting. And I just want to say, as a concerned citizen, I'm delighted to hear about your recommendation, Roberto. I think it's really proactive and the right one. I think we're not in last summer. This is a new year. A lot has happened since last summer. I don't believe we should be asking people to mask up when they've been 2 weeks post second shot vaccine. I think we are a society that needs to promote personal responsibility. So if you're particularly vulnerable with an underlying condition, you should have the personal responsibility to take action. But for those who are vaccinated and post 2 weeks vaccine, should have the right to walk down the street without masking up, because if you're vaccinated, any potential virus is not coming from your body and from your breath. So we've come a long way in a year. And I think we have to focus on both the mental health, particularly of our young people. This is just, we have to recognize we're in a new era and a new year. And to say that people are comfortable and used to masking up, that's a really sad statement. And I don't think it's accurate. And furthermore, I would like you to speak on the positivity rate, because I think it's such faulty math as far as I'm concerned. If you have 2 people who test on a given day and 1 is positive, we have a 50% positivity rate. It doesn't seem to make any sense. And with asymptomatic testing being curtailed now and needing an appointment and so forth, I think we're going to have less asymptomatic testing. And so therefore, potentially our positivity rate will be higher. But I don't understand if you could speak to why the positivity rate is meaningful. Because I just don't think it is. And I don't think we're talking enough about that. So if you could speak to those issues, I'd be grateful. And thank you again for hosting this meeting today.
Absolutely. So the positivity rate that we, lowered Hap's hand, my apologies. Hap, if you can raise your hand again.
Okay.
So with the positivity rate that we're running into is, yes, absolutely. One out of 2 is 50%. But the way we do it is we do a 7-day running average, so that it's not just 1 day's worth of positivity, because yes, you will see positivity of 50%. But unfortunately, yeah, you are absolutely correct. As people aren't testing as much anymore, as the asymptomatic testing is still capped, less people show up, things like that, the smaller the sample size, the higher that positivity number will be. And then we are also using, it's an issue of small sample sizing, in that every number that comes back positive is a higher percentage now. So across the country, across the world, when they use the positivity rate, the number was always inflated, because when you are testing symptomatic individuals with the idea of looking for a specific virus, you are more likely to find that virus. So that is a relic of the epidemiology when it comes to this. So that, yes, that is absolutely right. Positivity rates do get inflated, but it is a general overall sense of how a population is doing. When we are able to calculate susceptible versus non-susceptible populations, the positivity rate is an important part of that. And then I think I answered that question, but I'm trying to see if there was there another question that I'm missing? All right. Okay.
No, that's my comments. Thank you.
Thank you. And then Hap, I think you're up.
Yeah, can you hear me?
Yes, sir.
Great. Thank you for hosting this again. Thank you for letting us join in. I've been a pretty hardcore masker from the beginning. And and I think it was really, I think that pretty much the people in Wisconsin and town did a good job last year of keeping their masks on, more or less. When people had their masks off, I did see a lot of angry staring and, a little bit of resentment that if I have to wear my mask, then everybody should have their mask on and that sort of thing. But now I'm sort of moving toward the follow the science. I've been vaccinated since March, and I guess if those numbers are going to be what you say they are, if it's going to be 50 or 60 or 70% of everyone on the island who's already vaccinated, then can this decision be made? My question is about timing. Does it have to be decided now about July, or is that something we can decide in July?
It's up to the board, really. There is always the board is always allowed to put a time frame. We can say we can lift this 2 weeks from now, 3 weeks from now, anything like that. Boston is pushing it back 2 weeks or 3 weeks, I believe.
I was just wondering if do we have to decide before May 1st what we're going to do in town in Wisconsin in July, or is that something we can look at the situation on the ground in mid-June and make that call?
I'll let the board decide on that one. I can't make that decision.
Did you want to comment, Meredith?
No, I think that that's a smart thought, that we wait until we not make, keep the mask order in place until our next meeting, and then we could see where we are then.
Comments from the board? I mean, I'd be okay with that. And
I would object.
I don't know who that was, but Jim?
I still get back to no matter how the board votes, if we vote to have downtown Wisconsin and the core in town, you have to have something set up to enforce it. And the way Roberto talks, we don't have the people to enforce it. So you're going to have people come off the boat from other towns and they're going to say, no, I don't have to wear it. The governor said we don't have to wear the mask. Now, when do I wear it? And where does it, do I go to the jetties and I have to wear my mask? Or how far down Orange Street do I have to go to wear my mask? And when you get to Wisconsin, what do you do? When you get to the top of the hill, do you have to put it on? And when you go down to the beach, do you have to put it on? And I'm not saying one way or the other. All I'm saying is, how are you going to enforce that?
Yeah, that's right.
And is it legal? It could be unconstitutional.
We are asking that people the board deliberate, and the board chair will call you. Use the raise hand function, or I will have to remove you from the meeting or mute you permanently.
Okay.
Thank you. But to answer that question, it is legal. The state of Massachusetts, the Supreme Court has already issued an opinion on this. Jacobson versus the state of Massachusetts allows the state under the 10th Amendment to create its own policing regulations, as long as that regulation is applied in a blanket way, even if it is geographically located.
Okay, Amy, you got your hand up?
Hi, this is Amy Eldridge. I just had a quick question, and it kind of was brought up with Mr. Cooper. We have people coming in from all other states that are looking at the travel guidelines and what the new rules are in Massachusetts for masks and traveling. Are we going to create confusion by them learning what mask rules are to then come to Nantucket and find out that we're completely different instead of just being on the same page as the state? Because there are other towns that are in the red like we are. And I understand we're trying to protect ourselves, but we also need to give some clarification and make it more user-friendly than being completely different from the state. And I just think you're going to create confusion, and you're going to have people calling each other out downtown, creating issues. And I just don't think that that's fair to the people coming here to visit, trying to do the right thing, and those that just don't understand that Nantucket has something different going on. Thank you.
Thanks, Amy.
Yeah, there are many towns across the state that still have their own mask orders, but it is sporadic.
Anybody else? Melissa?
Thanks, Steve. I guess this may or may not relate, but Roberto, are there vaccine requirements for different jobs, or is that all just individual choices or individual business? I'm just trying to think about places like landscaping and construction, and how hard it is to do that work. I mean, it's hard to do any kind of 8 or 10-hour shift with a mask on, and certainly our nurses and doctors know that, but it's probably equally as challenging when you're outside. So are there those kinds of restrictions or requirements rather?
No, there aren't, because the vaccine is still under use as an emergency use authorization. It hasn't been fully approved as a complete, it hasn't completed stage 4 clinical trials and hasn't been completely approved by the FDA. So it's still not able to be required as part of a job as part of employment and things like that because of that EUA. Until it gets fully approved, then you can do it. To put it in perspective, the MGH hospital system still isn't requiring all of their staff to be fully vaccinated for that very reason.
And I know as far as schools in the state of Massachusetts, you're still allowed to say that vaccines are against your religious beliefs, even though there are no religions I know of that are against vaccines. There are still lots of kids in the school that have no vaccines. So I don't think that any jobs can require you to be vaccinated.
Anybody else? Melissa?
Thanks, Steve. I guess I'll just share where I'm thinking. You know, I came into this meeting, as I said earlier, concerned about the crowding. I think that Mr. Cooper made a good point, Hap, about that we can reconsider this. And, you know, I would be comfortable with lifting the outdoor mask mandate. I think now, particularly while we're still in a lower number of residents, that number of 22,000 doesn't surprise me, having just driven out and run some errands for a little bit today. It's a lot of people on the road. But I think, you know, we certainly as the Board of Health can choose to revisit this if we're seeing things not trending positively. And for me, those indications would be you know, getting higher numbers of caseload. And Roberto, I think, you know, getting communication from you on how those cases are being transmitted is going to be really important for us to be able to make those kinds of policy decisions. If the information's available, you know, is it outdoor, is it not? But and then we can see how this goes as our population increases and how this vaccine rollout is going. I'm very heartened to hear that this week we have more doses of vaccine coming in. We've got great partners who have applied to give vaccine in Dan's Pharmacy and Act Dental Arts and hopefully Health Imperatives. Antigen testing and even some additional PCR testing is going to be available through different avenues. So I feel like we have an increase in those resources. If we didn't have those in tandem with the lifting of the mask order, I think I'd be more concerned, to be honest.
Thanks. Anyone else before somebody would want to propose a motion about the mask order? Jim?
I'm just gonna, I don't want to harp on this thing, but I just want to just want to understand something. Before we vote on keeping the masks in the core districts, does Roberto have something in place if we vote that way to police this? Because if he doesn't, then there's no sense in even voting on something like this because no one's going to adhere to it.
To put it in perspective, we put a COVID officer position up on the website to hire somebody 6 weeks ago, and we still have had 0 applications.
So we'll have nobody to police this thing other than people talking to other people saying, listen, you're in the core district, you need to have your mask on.
The only people who would be able to really go out there would be our staff, and our staff is busy doing the other things that the health department does. Everything from septic system inspections, housing inspections, food inspections, water inspections, everything from the harbor, tobacco, other types of vaccine, other types of epidemiology. To use our public health nurse's words, it's very hard for people to understand what it is that a health department does. We are responsible for over 100 different state regulations, and we have 3 field workers.
So I just don't want the Board of Health to pass something that has absolutely no teeth in it, and that we can't, live up to what we want to have. And I'm not saying, one way or another, but if we vote to keep the masks on in certain places, if we vote for that, we have to have some teeth into that, and we have to have people to make it happen.
Melissa?
I hear what you're saying, Jim. I guess, my sense is that last year we had that same mask mandate in the core districts before we went island wide, and it worked fine. I think a lot of different business groups helped spread that message, particularly like rental agencies. The boats did a decent job. It wasn't perfect, but it was a decent job. And I think we got a fair compliance. I had a very similar viewpoint about, passing rules or regulations that weren't necessarily enforceable. And I think I've started to change my tune on that, though at this moment, I'm leaning towards not having a mask mandate in those core districts anyway. So I'm not even sure if that's going to be what the motion is that's proposed. If it is, and that's what passes, I'm confident that it becomes a message of personal responsibility that we recommend, not one that we're going to be actively out trying to ticket people for.
Okay, Pamela, you got your hand up?
Yes, I just have one quick question. With the removal of masks, is there any social distancing that will still have to be in place, Roberto? Or because when you look at the CDC chart, there are different standards for like vaccinated and unvaccinated people, but obviously you can't figure that out. So I was just curious as to how you would handle that kind of thing. And then if a restaurant has indoor and outdoor seating, would the staff still wear a mask when they're serving people outdoors? Just curious.
Yes, the staff is still required to wear masks, just because of that's part of the restaurant regulations from the state. But yes, the social distancing is still in place. The regulation that the state of Massachusetts just brought down that starts today says that you don't have to wear a mask outdoors if social distancing cannot be done. So they still want 6 feet of separation. And then the governor was explicitly clear that in events like at Fenway, at Gillette, even school football stadiums, things like that, even if you are outdoors, since you're going to be in a larger group, you still have to wear masks. So there are still requirements to wear masks, even if you are outdoors for some cases. But the regulation specifically states that if you cannot social distance, then you should be wearing a mask, even if you are outside. And as you said, it's impossible to know who is vaccinated and who isn't. And honestly, the concept of the vaccine passport is downright offensive. That'll create tiered levels of society, and that causes way more harm than good. I know that's not what you suggested. It's just that's a conversation that's being had globally right now. And but yeah, it's impossible to know who is vaccinated and who isn't. And if they're not willing to show you the cards, we can never force them to give us that information either.
Thank you. I think I'm on the same page as you there. And I think that, like Melissa was saying, we would just have to hope that people do the right thing for their neighbors and friends, and that I don't think it's confusing. I think anyone who knows anyone who was visiting Nantucket last summer gave them the information on what they had to do. And I just think it is a lot about social responsibility and caring about the community. Thanks.
Thank you.
So I think, Melissa, you got a pretty good grip on what you'd propose for a motion.
Did I have a motion?
Yeah.
Well, I suppose the motion that I would make would be to remove the mask mandate outdoors per Roberto's recommendation. I don't have the emergency order in front of us. Would we be rescinding that order, Roberto, or modifying it?
Just modifying it to remove the outdoor sections. It is order number 13.
Okay. So that would be my motion.
Can I get a second?
I'll second that.
Okay.
I'm sorry, can you just repeat that again?
Sure. Mary, I made the motion to remove the outdoor mask mandate in emergency order 13.
For the entire island, not just
for the entire island.
Okay.
Yeah.
Can I get a second?
I second that.
Okay. All in favor by roll call. Melissa Murphy,
Aye.
James Cooper,
Yes.
Meredith Lepre,
No.
Steve Visco says yes. So, the order's lifted if we see something happening in the next few weeks, and we can always change whatever we need to change. Melissa?
Thanks, Steve. I guess as a follow-up to that, I do want to see how things are rolling out in terms of our positivity rate and the vaccination rollout, and just in general, how things are flowing in town. I do think there's a good degree of hesitation even amongst board members here today. Are we making the right decision? Because we do want to protect our community, and at the same time, recognizing that we're in a challenge with enforcement and we need to move forward. So I would like to see us come back and have this conversation if we see things not moving in the right direction, and putting the masks in those areas. And if I recall correctly, when we did that in the historic areas, there were clearly defined maps that are very difficult for some people, especially visitors, to understand, but I do believe it is doable. And there's a question, is this lifted immediately? Is this rescinded immediately, or is there a date certain?
Up to you.
I would say as of today. Do we need to make another motion for that?
Sorry, I just want it noted that I am really against this, because I think that it's a lot harder to take something away and then have to put it back in place. I think that we're probably shooting ourselves in the foot with this, but also, I don't understand why it was a big deal to not just keep it until our next meeting to see where we are as an island, because now things could blow up in the next week, and there likely will be a lot more cases because it's 2 weeks from school vacation. And now we're going to come back and say, oh, no, sorry, we were wrong. You should wear your masks. So I think that probably saying, okay, now we've decided you can not wear masks everywhere is maybe the wrong message.
That's not what that's not what we voted, though. We didn't say you couldn't wear masks anywhere. We just said outside.
Right. But then we're going to have to possibly put that back in place again. So I think that that's a lot harder to do when we already had it in place. So I just think that it would have been smart to keep it in certain areas and hope that people have good social responsibility rather than now having to possibly in May or June put it back in order and back in place. I just sort of think that maybe we're sending the wrong message. That's my opinion from a medical perspective.
Do we have to make a motion for the date or?
No, if you don't set a date, it becomes immediate.
Well, we didn't set a date, so I guess it's immediate. Anybody have any other comments? I actually have a 1:45 appointment I got to go to, so if you're gonna stay on, could somebody else just close the meeting for me?
Sounds good.
I'll make a motion to adjourn.
You will. Be everybody okay with that, or? Okay, can I get a second?
Second,
All in favor by roll call vote? Melissa Murphy,
Aye.
James Cooper,
yes.
Meredith Lepore,
Yep.
and Steve Visco says yes. Thanks, everybody. I guess you're welcome to stay on and if you don't have to go, but thanks for showing up.
All right, thank you.
Thank you, everyone.